How's your stomach feeling today? Is everything fine, or do you notice something unusual? Grab a pen and paper because we're diving into an important topic: the 8 unusual signs of stomach cancer that many people overlook. But before we delve in, like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. Understanding these signs is critical because early detection can save lives, possibly even your own. According to the American Cancer Society, the 2024 statistics for stomach cancer in the United States are alarming. An estimated 26,890 new cases are expected, and approximately 10,880 deaths will occur due to this disease. What makes stomach cancer particularly dangerous is its silent nature. The symptoms are often subtle or mistaken for less serious issues. When caught early, stomach cancer is highly treatable. However, if detected late, it becomes much harder to manage. A century ago, stomach cancer was a leading cause of cancer-related deaths, largely due to dietary habits and food preservation methods like heavy salting before refrigeration. Today, it's less common in developed countries, but this decrease has made its warning signs easier to miss. If you notice any of the symptoms discussed in this video, it's crucial to seek medical attention promptly. These signs could indicate early or hidden stages of gastric cancer. Additionally, we'll share practical preventive measures to reduce your risk of developing stomach cancer, so make sure to watch until the end. But first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals and share this information with loved ones. It could save a life. Have you or someone you know been affected by stomach cancer? Where are you watching this video from? Drop your thoughts in the comments below. 1. Feeling full too quickly. Do you find yourself eating just a few bites and suddenly feeling like you've had a large meal? This isn't just a lack of appetite. It could be your stomach signaling fullness incorrectly, which may indicate underlying issues. If this happens consistently without a clear cause, such as stress, illness, or new medications, it's worth investigating. 2. Blood in stool or vomit. Though rare in early stomach cancer, occurring in 10 to 15% of cases, blood in vomit or stool can be a red flag, especially for advanced stages. It may appear as dark, tar-like stool or as vomit resembling coffee grounds. However, it's important to note that bleeding can also result from other conditions, like ulcers, so timely medical evaluation is essential. 3. Persistent fatigue. Unlike everyday tiredness, cancer-related fatigue feels unrelenting and doesn't improve with rest. It's often accompanied by symptoms like shortness of breath, muscle weakness, dry skin, hair loss, and even changes in mood, such as anxiety or depression. 4. Stomach discomfort. This can range from burning sensations, heartburn, and abdominal pain to bloating or digestive issues. Each of these symptoms can vary in intensity depending on the tumor's location and stage. Stay tuned to learn more about these and other symptoms, along with actionable steps to protect your stomach health. By the end, you'll have valuable knowledge to share and possibly save lives. 5. Sudden weight loss. Unexpected weight loss can be a symptom of various medical conditions, ranging from benign issues to serious illnesses like cancer. In fact, for many cancer patients, it's often one of the first noticeable signs. Studies show that approximately 40% of cancer patients experience unexplained weight loss at the time of diagnosis, and this figure increases to 80% in those with metastatic, advanced stage, cancer. The causes of weight loss in such cases can be multifaceted: fatigue and loss of energy. Cancer disrupts the body's metabolic processes, leaving patients with less energy for daily activities. Decreased appetite. The tumor or associated treatment side effects can lead to a reduced desire or ability to eat. Tumor-related factors. Depending on the tumor's location, It may obstruct the gastrointestinal tract, making it difficult to swallow or digest food properly. This type of weight loss often occurs without intentional effort and should always prompt further medical investigation to rule out serious conditions. 6. Pain in the upper stomach, pit of your stomach. Persistent discomfort or pain in the upper abdomen can often be misinterpreted as a minor issue like acid reflux or an upset stomach. However, overlooking this symptom can delay critical diagnoses. One common mistake people make is self-medicating with acid-reducing medications such as omeprazole. While these medications do not cause cancer, they can mask the symptoms, giving a false sense of relief and leading to delayed detection of underlying conditions. To put it simply, relying on these medications without medical advice is like covering up your car's check engine light with tape. It may temporarily hide the problem, but the issue persists and could worsen. If you experience such discomfort, consult a doctor for proper evaluation instead of attempting to manage the symptoms on your own. 7. Nausea and vomiting. Although nausea and vomiting are common symptoms that can result from various non-serious causes, persistent or recurrent episodes warrant closer attention. When these symptoms don't resolve after standard treatments or continue to interfere with your daily life, they could indicate an underlying health condition that needs immediate evaluation. In the context of stomach cancer, nausea and vomiting may occur due to obstruction, a tumor blocking the passage of food through the stomach or intestines; inflammation or irritation, cancer-related changes to the stomach lining; delayed stomach emptying, caused by the tumor affecting normal stomach function. If these symptoms persist, consult a healthcare professional for advanced testing to identify or rule out serious conditions. Ignoring prolonged nausea and vomiting could delay timely intervention and treatment. 8. Abnormal liver growth and advanced symptoms. When stomach cancer progresses to advanced stages, it often spreads, or metastasizes, to other organs, with the liver being a common target. This occurs because the liver's rich blood supply makes it an ideal environment for circulating cancer cells to settle and grow. Metastasis to the liver may result in symptoms such as jaundice, yellowing of the skin and eyes, unintentional weight loss, and persistent abdominal pain or swelling. Other advanced symptoms may include swollen lymph nodes on the left side of the neck, known as Virchow's node. This is often a sign of cancer spreading. A palpable mass in the stomach region. This indicates significant tumor growth that can be felt during a physical examination. Lumps near the belly button, also referred to as Sister Mary Joseph's nodule. This signifies the spread of cancer to the peritoneum, the lining of the abdominal cavity. At this stage, the disease has reached an advanced level, requiring urgent and comprehensive medical intervention. How stomach cancer is diagnosed. The only definitive way to diagnose stomach cancer is through a biopsy *, typically conducted during an endoscopy. During this procedure, 1. A gastroenterologist inserts a thin, flexible tube equipped with a camera through the patient's mouth. 2. The tube is guided down the esophagus to the stomach. 3. The doctor examines the stomach lining for abnormalities and collects a tissue sample for laboratory analysis. If the biopsy confirms stomach cancer, additional imaging tests, such as CT scans or MRIs *, are performed to determine the extent and stage of the disease. Treatment options for stomach cancer. Treatment for stomach cancer depends on the stage of the disease, the patient's overall health, and other factors. The primary treatment approaches include 1. Surgery. For early-stage cancer, surgery may be curative. This typically involves removing the tumor, part or all of the stomach, and nearby lymph nodes to prevent further spread. 2. Chemotherapy. Uses specialized drugs to destroy or inhibit cancer cells. Can be used before surgery, to shrink tumors, after surgery, to kill remaining cells, or as a standalone treatment for advanced cases. 3. Radiation therapy. employs high-energy radiation to target and kill cancer cells. Often used alongside chemotherapy or surgery to improve outcomes or relieve symptoms. 4. Targeted therapy focuses on specific genes, proteins, or the tissue environment contributing to cancer growth. Drugs used in targeted therapy are often less damaging to healthy cells than chemotherapy. 5. Immunotherapy activates the body's immune system to fight cancer more effectively. 6. Palliative care. For advanced or incurable cases, palliative care focuses on symptom management and improving the patient's quality of life. How to prevent stomach cancer. Although not all cases of stomach cancer can be prevented, adopting certain lifestyle changes can significantly reduce your risk. 1. Healthy diet. Consume a diet rich in fruits, vegetables, and whole grains. Avoid processed, smoked, and salty foods. 2. Avoid smoked and pickled foods. These contain compounds that may increase cancer risk. Fresh, unprocessed foods are a healthier choice. 3. Avoid smoking. Smoking is a major risk factor for stomach cancer and many other diseases. 4. Limit alcohol consumption. Excessive alcohol intake can elevate cancer risk. 5. Maintain a healthy weight. Regular exercise and a balanced diet can help reduce cancer risk. 6. Treat Helicobacter pylori, H. pylori, infections. This common bacterial infection is a significant risk factor for stomach cancer. If diagnosed, follow your doctor's treatment plan to eliminate it. The most critical factor in treating stomach cancer is early detection. When caught early, stomach cancer is highly treatable and even curable. However, advanced stages pose significant challenges. Modern diagnostic tools, like upper endoscopy, allow doctors to identify cancer at its earliest stages. Relying solely on medications to suppress symptoms, e.g., antacids for heartburn, without knowing their cause can delay diagnosis and treatment. Blood tests for tumor markers are not reliable for diagnosis. Endoscopy remains the gold standard. This isn't about worrying over every minor stomach ache, but about recognizing persistent and unusual symptoms and seeking medical attention promptly. Are you familiar with these signs and symptoms of stomach cancer? Leave a comment below to share your thoughts or experiences. If you found this information helpful, type "yes" in the comments, and be sure to check out the videos we've selected just for you. Don't forget to like, share, and subscribe to our channel for more life-saving insights. Thanks for watching.